Good evening, everyone, and thank you for being here. Today, we're diving into a topic that's both widely misunderstood and deeply consequential: vitamin in supplementation in older adults. More specifically, we'll be unpacking 3 vitamins that seniors should not be taking after the age of 60. This may come as a surprise to many, especially given the common belief that more vitamins equal better health. But, as we'll see, the truth is far more nuanced and rooted in both neuroscience and cellular biology. Let's begin by reframing our understanding. Vitamins are not inherently good or bad. They're molecules, tools. The body is an exquisitely tuned machine, and these molecules act like keys and locks. But the wrong key, or too much of the right one, can disrupt the very systems we aim to support. Part I, the context of aging and the brain-body connection. As we age, our neurochemistry, metabolism, and hormonal balance change significantly. What was once beneficial at 30 can be destabilizing at 60. Why? Because homeostasis, the body's tendency to maintain internal stability, becomes more fragile with age, and many vitamins, especially when taken in high doses or without medical need, can push the system out of balance. Let's explore the 3 major culprits. 1. Vitamin A or retinol and retinyl esters. Vitamin A plays a critical role in vision, immune function, and cellular growth. However, excessive intake, especially from supplements, can be toxic, particularly in older adults. The science: vitamin A is fat soluble, meaning it accumulates in the body's tissues, particularly the liver. Over time, even modest excesses can lead to hypervitaminosis A, a condition characterized by dizziness, nausea, liver dysfunction, and even cognitive decline. In seniors, this poses a double threat, both to physical health and to neurological integrity. Aging also reduces liver function, making it harder to clear excess vitamin A. Research shows that elevated vitamin A levels can exacerbate bone loss, increasing the risk of fractures, a significant issue in this age group. Real-world application: if you're over 60 and not clinically deficient, avoid multivitamins that contain preformed vitamin A, often listed as retinyl palmitate or retinyl acetate. If needed, opt for beta-carotene from whole foods, which the body converts to vitamin A only as needed. 2. Vitamin E tocopherols and tocotrienols, often marketed as an antioxidant powerhouse. Vitamin E has long been touted for its potential to reduce oxidative stress. But here's the reality: in high doses, it may actually increase the risk of hemorrhagic stroke, especially in seniors. The science: vitamin E interferes with vitamin K, which is crucial for blood clotting. In older adults, many of whom are on blood thinners, this interference can be dangerous. Studies, including large-scale meta-analyses, have found that supplemental vitamin E above 400 IU per day is associated with increased all-cause mortality and stroke risk. Furthermore, while oxidative stress does increase with age, blanket suppression of free radicals can impair essential signaling pathways, especially in the brain. The nervous system relies on a delicate balance between oxidation and reduction. Oversupplementing antioxidants can blunt neuroplasticity, the brain's ability to adapt and form new connections. Real-world application for those over 60: dietary sources, like nuts, seeds, and leafy greens, are safe and effective. But high-dose vitamin E supplements should be avoided unless specifically prescribed for a medical condition. 3. Iron, ferrous sulfate, and other forms. Iron is essential for oxygen transport and energy production. However, excess iron becomes a pro-oxidant, meaning it generates free radicals that can damage cells, particularly in the brain. The science: postmenopausal women and older men rarely experience iron deficiency unless they have an underlying condition. Iron stores naturally increase with age. In excess, iron deposits in tissues. A process called iron overload can lead to neurodegeneration, cardiovascular damage, and liver dysfunction. Brain imaging studies show that elevated brain iron is associated with increased risk of Alzheimer's and Parkinson's disease. Why? Because excess iron accelerates oxidative stress in neurons, which are particularly vulnerable due to their high metabolic demands and limited regeneration capacity. Real-world application: iron supplements should only be taken after blood tests confirm a deficiency. For seniors without anemia, routine iron supplementation can do more harm than good. Conclusion: wisdom in precision. The takeaway here is not that vitamins are bad, but that precision matters. Supplementation should never be a blanket strategy, especially after 60. Aging is not a disease. It's a phase of life that requires more tailored inputs, more deliberate decisions, and greater awareness of how our internal systems are changing. Here's what we know from neuroscience and aging research. Small perturbations in biochemistry can have outsized effects in an older brain and body. The key is not to overwhelm the system, but to support it strategically through targeted nutrition, lifestyle optimization, and when needed, evidence-based supplementation. As you move forward, I encourage you to rethink your supplement shelf. Consult your physician, ask for blood work. Don't supplement based on marketing, supplement based on need, because the goal is not just to live longer, but to remain cognitively sharp, physically agile, and deeply engaged with life. As we grow older, our bodies begin to change in many ways. One important area that changes is how we process and store nutrients. Vitamins, which many people believe are always helpful, can sometimes become harmful, especially when taken in large amounts without medical need. One such vitamin is vitamin A. Vitamin A is important for many things. It helps us see clearly, especially at night. It supports our immune system, which helps the body fight off infections. It also plays a role in how our cells grow and how our skin and other tissues stay healthy. Because of all these important functions, many people assume that more vitamin A must be better, but that is not always true. Vitamin A is a fat-soluble vitamin. This means that, unlike water-soluble vitamins like vitamin C or the B vitamins, it does not easily leave the body through urine. Instead, it is stored in the liver and in fat tissue. If you take more vitamin A than your body needs, it stays in your body and builds up over time. This can lead to a condition known as vitamin A toxicity. Vitamin A toxicity means that there is too much vitamin A in the body. This can cause a number of health problems. One of the main problems is that it puts stress on the liver. The liver is the organ that stores and processes vitamin A. When there is too much of it, the liver becomes overloaded. This can lead to liver damage. In serious cases, it can even result in liver disease. Older adults are especially at risk. As we age, our liver becomes less efficient. This means it doesn't process and clear out extra substances as quickly as it used to. So, if an older person continues taking vitamin A supplements without needing them, or if they eat foods that are very high in vitamin A every day, their liver may not be able to handle it. Over time, this leads to the vitamin A building up and harming the liver's ability to function properly. Another problem with too much vitamin A is its effect on bones. Many people worry about bone health as they get older because bones naturally become weaker with age. Taking too much vitamin A can make this problem worse. High levels of vitamin A in the body can cause bones to lose calcium. Calcium is what keeps bones strong. When there isn't enough calcium, bones become thinner and more fragile. This increases the risk of fractures, especially in the hips, spine, and wrists. This is a serious concern because falls are already a major health risk for older adults. If someone has fragile bones, a small fall could lead to a broken bone, which may result in hospital stays, surgeries, and even long-term disability. In fact, research has shown that older adults who take high doses of vitamin A are more likely to break a bone than those who do not. But the harm doesn't stop there. Too much vitamin A can also affect the brain. Our brains are very sensitive to chemical changes in the body, especially as we get older. Vitamin A, when it is present in the right amount, supports healthy brain function. But when there is too much, it can cause problems. Some studies have found that high levels of vitamin A are linked to changes in mood, such as increased feelings of anxiety, irritability, or even depression. Others have found that it can slow down certain brain functions like memory and concentration. The reason for this is that vitamin A affects how brain cells communicate with each other. When levels are too high, the balance of chemicals in the brain can shift in ways that are not helpful. In older adults who may already be facing age-related memory decline, these changes can be even more noticeable and troubling. All of these effects on the liver, bones, and brain show why it is so important to be careful with vitamin A, especially after the age of 60. It is easy to think that taking a daily multivitamin is always a good idea, but not all supplements are safe for everyone. Many multivitamins contain vitamin A, often in the form of retinol or retinyl palmitate. These forms of vitamin A are already active in the body, and they are more likely to build up and cause problems when taken in excess. There is also another form of vitamin A called beta-carotene, which comes from plant-based foods like carrots, sweet potatoes, and spinach. Beta-carotene is converted into vitamin A by the body, but only when it is needed. This makes it much safer because it's harder to overdose on. Eating fruits and vegetables that are rich in beta-carotene is a good way to get vitamin A without putting your body at risk. To avoid vitamin A toxicity, the best approach is to focus on a balanced diet with a variety of whole foods. Unless a doctor has told you that you are deficient in vitamin A, and that is actually quite rare, it's usually not necessary to take it as a supplement, especially not in high doses. If you do take a multivitamin, check the label and make sure it doesn't contain too much preformed vitamin A. The daily upper limit for adults is about 3,000 micrograms of retinol activity equivalents Ray, but many experts suggest older adults aim for less than that unless they are under medical supervision. In summary, vitamin A is a helpful and necessary nutrient when taken in the right amount, but taking too much, especially from supplements, can lead to serious health problems for older adults. The liver may become damaged, bones may become weaker and more likely to break, and the brain may begin to function less clearly. These risks increase with age, so it is especially important for people over 60 to be mindful of how much vitamin A they are taking. The good news is that most people can meet their vitamin A needs through food. Colorful vegetables, leafy greens, and even some dairy products provide plenty of this important nutrient in safe amounts. With the right choices, it's possible to stay healthy without the risks that come from taking too much. When it comes to health, more is not always better. For seniors, it's not just about adding things to your routine, it's about knowing what to remove or reduce in order to protect your long-term well-being. Many people take vitamins because they want to stay healthy, feel better, or slow down aging. One vitamin that has become very popular is vitamin E. It is often described as an antioxidant, which means it helps protect the body from damage caused by something called oxidative stress. Oxidative stress happens when there are too many harmful molecules in the body, called free radicals. These free radicals can damage cells, including those in the heart, brain, and other organs. Because vitamin E helps control these harmful molecules, people think taking more of it must be good, but that is not always true. In fact, taking large amounts of vitamin E can be dangerous, especially for older adults. When vitamin E is taken in high doses through supplements, it may increase the risk of having a stroke. A stroke happens when blood flow to part of the brain is blocked or when a blood vessel bursts and bleeds into the brain. In both cases, the brain does not get the oxygen it needs and brain cells can die. This is a serious medical emergency and can cause long-term damage or even death. One type of stroke, called a hemorrhagic stroke, happens when a blood vessel in the brain bursts. This causes bleeding in the brain. High doses of vitamin E can make this type of stroke more likely. The reason is that vitamin E affects the way blood clots. Our blood needs to clot properly to stop bleeding when we get a cut or injury. Vitamin E, especially in large amounts, can make it harder for the blood to clot. This means that even a small blood vessel that bursts may lead to more bleeding than normal. That is especially dangerous in the brain, where even a little extra bleeding can cause serious damage. Older adults are more at risk for strokes in general, and many take medications like aspirin or blood thinners to manage heart disease or prevent blood clots. When high-dose vitamin E is added on top of these medications, it can make the blood too thin. This increases the risk of bleeding in the brain and other parts of the body. Studies have shown that people who take more than 400 international units IU of vitamin E per day may have a higher risk of dying from various causes, including strokes. This finding has made many doctors more cautious about recommending high-dose vitamin E, especially for people over the age of 60. Aside from the risk of stroke, there is another reason to be careful with large doses of vitamin E. It has to do with how the brain works. Our brains rely on a delicate balance of chemicals and signals to function properly. One part of that process involves something called oxidative signaling. While it is true that too much oxidative stress can harm the brain, the body also uses small amounts of these stress molecules to send messages between cells. This is especially important in the brain, where signaling between nerve cells is how we think, remember, move, and feel. If someone takes too much vitamin E, they may reduce oxidative stress too much. This sounds like a good thing, but in reality, it can interrupt important processes. When the brain is not able to use oxidative signals the way it needs to, the communication between nerve cells can slow down or become confused. This may affect memory, learning, mood, and overall brain performance. It's like trying to hold a conversation while someone is constantly lowering the volume. You may not hear the message clearly. In younger people, the brain can often adjust and recover from these changes. But in older adults whose brain function may already be slowing down, this added disturbance can make a noticeable difference. Some people might feel more tired, have trouble focusing, or feel emotionally flat or anxious without knowing why. They may not realize that their high-dose vitamin E supplement is playing a role in this. There is also growing concern that long-term use of high doses of vitamin E may affect the brain in deeper ways. Some research suggests that the brain's ability to form new connections, a process called plasticity, may be reduced when oxidative signaling is overly suppressed. This is important because plasticity is how the brain adapts to new information, recovers from injuries, and stays flexible as we age. If this process is slowed down, it might make it harder for an older adult to learn new things, recover from stress, or keep their mind sharp. All of this shows that more is not always better when it comes to vitamins. The body is designed to use only what it needs, and taking more than that can sometimes do harm. While vitamin E from food sources like nuts, seeds, and leafy greens is safe and healthy, taking large doses in pill or capsule form is a different matter. The body absorbs it differently, and it is easier to get too much without realizing it. Another important point is that vitamin E is fat-soluble. This means that, like vitamin A, it stays in the body's fat tissues and does not leave quickly. Over time, it can build up and reach levels that are too high, especially in older adults whose bodies may clear substances more slowly. So even if someone takes what seems like a small extra amount each day, the total amount in the body can grow over weeks and months. People who take multiple supplements are also at risk of getting more vitamin E than they think. For example, someone might take a multivitamin, a separate vitamin E supplement, and a skin product that contains vitamin E oil. Each of these adds to the total amount in the body. Without realizing it, they may be pushing their vitamin E levels higher than is safe. To stay healthy, it's best to focus on getting vitamins from a varied and balanced diet. Most people can get enough vitamin E from foods without needing to take extra pills. If someone does need a supplement, it should be at a low dose and only under the guidance of a doctor or health care provider. Blood tests and health history can help determine whether a supplement is truly necessary. In conclusion, while vitamin E is an important nutrient and does offer health benefits, it must be used with care, especially by older adults. Taking too much can increase the risk of serious health problems like strokes and can interfere with the brain's natural way of sending signals. What seems like a simple daily pill can have powerful effects on the body, for better or for worse. That's why it's always better to ask, check, and be cautious when it comes to supplements. Iron is a mineral that plays many important roles in our bodies. It helps red blood cells carry oxygen from the lungs to every part of the body. It also supports energy production, helps the immune system fight off infections, and even plays a part in our brain's ability to think clearly. Because iron is so vital, many people believe that taking extra iron supplements is harmless or even helpful, especially as they get older. However, it turns out that too much iron can become a serious problem, one that can damage the brain and other organs. For this reason, older adults should only take iron if it is truly needed and recommended by a doctor. When we eat foods that contain iron, such as red meat, beans, or spinach, our digestive system absorbs only the amount of iron the body requires. The rest passes through without being absorbed. This natural control helps prevent iron levels from rising too high. But when someone takes iron in pill form, especially without medical supervision, they can bypass this safety mechanism and allow iron to build up over time. This condition, known as iron overload, means that iron starts to collect in places it shouldn't. One of the first organs to be affected by iron overload is the liver. The liver acts as a storage center for many nutrients, including iron. When too much iron arrives, the liver stores it until it reaches capacity. Once the liver is full, excess iron spills into the bloodstream and settles in other organs, including the heart, pancreas, and brain. Over the years, this extra iron can cause harm. In the heart, it can make the muscles stiff and weak, leading to problems with the heart's ability to pump blood. In the pancreas, it can interfere with the production of insulin, raising the risk of diabetes, and in the brain, it can lead to changes that affect memory, coordination, and mood. The brain is especially sensitive to iron levels because it uses iron to help form myelin, the protective coating around nerve fibers that ensures fast communication between brain cells. A small amount of iron supports this process, but too much can be dangerous. Excess iron in the brain creates a type of chemical reaction that produces harmful molecules called free radicals. Free radicals are unstable atoms or molecules that can damage cells, proteins, and DNA. When free radicals accumulate, they create a state known as oxidative stress. The brain's own defenses against oxidative stress weaken with age, making older adults more vulnerable to damage. Over time, this stress can break down myelin and harm the delicate connections between neurons, the cells that transmit information in the brain. As a result, thinking speed, memory, and physical coordination may all suffer. In addition to these long-term effects, iron overload can also cause more immediate symptoms. People may feel tired or weak because iron is no longer available in the right places for its normal roles. They may experience joint pain as iron collects in the joints, causing inflammation. They might notice changes in skin color, sometimes developing a bronze or grayish tint as iron deposits under the skin. Their blood tests may show high levels of certain liver enzymes, indicating that the liver is under stress. Yet, these signs are often overlooked or attributed to other causes in older adults, such as arthritis or simply getting older, which can delay proper diagnosis and treatment. Not everyone who takes iron supplements will develop iron overload. The risk is much higher in people who have certain genetic conditions, such as hemochromatosis, which affects the body's ability to regulate iron absorption. However, these genetic forms often do not show clear symptoms until later in life, and many people may not even know they carry the gene. That is why routine supplementation without testing can be risky. For older adults whose organs and tissues may already be aging and less able to repair damage, the extra iron can push fragile systems over the edge. Doctors typically check iron levels through blood tests before recommending supplements. They look at markers such as serum ferritin, which reflects stored iron levels, and transfer in saturation, which shows how much iron is being carried in the blood. If these tests indicate low iron, often called iron deficiency anemia, then supplements may be necessary to restore healthy levels. Iron deficiency anemia causes symptoms like fatigue, shortness of breath, and pale skin because the body does not have enough iron to produce healthy red blood cells. In these cases, iron supplements can provide relief and improve quality of life. But if blood tests show that iron levels are in the normal range or high, there is no benefit in taking extra iron. In fact, adding more iron can worsen one's health. For older adults, it is particularly important to avoid self-medication with iron supplements. Family members or friends may suggest iron pills for energy or better health, but without a doctor's guidance, these pills may do more harm than good. The good news is that most people get enough iron through a balanced diet. Foods such as lean meats, poultry, fish, beans, lentils, whole grains, nuts, and leafy green vegetables all provide iron in forms that the body can absorb safely. Moreover, the body's natural absorption process is more selective with food sources, reducing the risk of overload. Vitamin C helps the body absorb iron from plant sources, but even then, the absorption adjusts to the body's needs, preventing excessive buildup. For this reason, dietary iron rarely leads to overload when consumed as part of a normal, varied diet. In cases where iron overload is discovered, there are treatments available. One common method is regular blood removal, similar to donating blood, called phlebotomy. By removing small amounts of blood at intervals, the body is prompted to use the excess iron to make new red blood cells, helping to lower stored iron levels. Another treatment is chelation therapy, involving medications that bind to iron and help the body expel it through the urine or feces. Both methods require close medical supervision and regular monitoring to make sure iron levels fall safely. For older adults concerned about their iron status, the best first step is to talk to a healthcare professional. A doctor will order the appropriate blood tests and interpret the results in the context of overall health, medical history, and any existing conditions. Only then can a decision be made about whether iron supplements are needed. If supplementation is recommended, the doctor will determine the right dose and duration, minimizing the risk of overload. To summarize, iron is a vital nutrient that supports oxygen delivery, energy production, and many other bodily functions. However, when iron gathers in excess, it can lodge in organs such as the liver, heart, pancreas, and brain, leading to serious health problems. Older adults, whose bodies are naturally more vulnerable with age, must be especially cautious. Instead of taking iron supplements on a whim, it is far safer to rely on a balanced diet and to use supplements only when tests show a real need. By following this careful approach, older adults can protect their organs, maintain healthy brain function, and avoid the hidden dangers of iron overload. As people grow older, their bodies go through many changes. Some of these changes are easy to see, like wrinkles or slower movement. But many changes happen inside the body where we can't see them, and they affect how well the body handles the nutrients it takes in. One important change is how the body processes vitamins and minerals, also known as micronutrients. These are tiny but essential substances that help the body work properly. When we are young, the body can usually handle small changes in nutrient levels without much trouble. But as we age, the body becomes less able to deal with too much of certain vitamins and minerals. This happens because of changes in metabolism and how well our organs work. Metabolism is the process that turns food into energy and helps the body use nutrients. When we're younger, our metabolism is usually faster and more efficient. The organs that support this process, like the liver, kidneys, and digestive system, are generally in good shape, but over time, metabolism tends to slow down. This means that the body may take longer to break down and use the nutrients we eat or get from supplements. If certain vitamins or minerals are taken in large amounts, they may stay in the body longer than they should. This can cause them to build up to levels that are no longer safe. One example of this is how the liver processes fat-soluble vitamins like A, D, E, and K. These vitamins dissolve in fat and are stored in the liver and other body tissues. They are different from water-soluble vitamins, which usually leave the body in urine if we get too much. In young people, the liver can often handle these fat-soluble vitamins without any problem, but in older adults, the liver may not work as well. It may not be able to store or release these vitamins correctly, or it may clear them from the body more slowly. This can lead to a gradual buildup over time, especially if someone is taking high-dose supplements every day. The kidneys are another important organ that changes with age. Kidneys filter the blood and help remove waste, including extra minerals like calcium, potassium, and iron. In younger adults, the kidneys do a good job of keeping the right balance of these substances. But in older adults, the filtering process can become slower and less accurate. If a person takes in more of a mineral than the body needs, the kidneys may not be able to get rid of the extra amount fast enough. As a result, levels can rise too high and cause problems in different parts of the body. For example, too much calcium can build up in the blood, causing confusion, weakness, or even damage to the heart and kidneys. The digestive system also changes with age. The stomach may produce less acid, which makes it harder to break down food and absorb certain nutrients. This can lead to low levels of some vitamins, like B12, even when someone eats enough of it. Because of this, people may start taking supplements to raise their levels, but they might also take other vitamins they don't need or take them in higher doses than necessary. Without careful monitoring, this can lead to an imbalance in the body. Sometimes, the problem isn't a lack of nutrients, but rather too much of something that the body can no longer handle well. In addition to slower metabolism and weaker organ function, the body's natural defenses may become less sharp with age. For example, the immune system doesn't respond as quickly or strongly, and the body is slower to repair itself after illness or injury. This means that if excess nutrients cause harm, such as damaging a part of the kidney or brain, it can take longer to heal. And in some cases, the damage may not be fully reversible. This makes it especially important for older adults to avoid taking too much of anything, even substances that are usually thought of as healthy. Another concern is that older adults are more likely to have chronic health conditions like heart disease, diabetes, or high blood pressure. They may also be taking medications to manage these problems. Some vitamins and minerals can interact with these medications, either making them less effective or causing side effects. For example, too much vitamin K can interfere with blood thinners, and too much potassium can affect the way heart medications work. When the body is less flexible and slower to adapt, these interactions can become dangerous more quickly than they would in a younger person. It's also important to remember that supplements are not always clearly labeled or easy to understand. Some products contain much more of a vitamin or mineral than the label suggests, and people often take more than one supplement at a time without realizing how much they are really getting. For instance, someone might take a multivitamin, a separate calcium pill, and a bone health supplement that also contains calcium. Without knowing it, they may be taking double or triple the recommended daily amount. In a young, healthy body, this might not cause immediate harm, but in an older body, it can be too much to handle. Even the brain is affected by excess nutrients when the body cannot manage them well. Some vitamins, when taken in high doses over long periods, may interfere with brain function. The balance of chemicals in the brain is very delicate, and adding too much of any one substance can affect memory, thinking, or mood. This is especially true in people who already have some cognitive decline or are at risk for dementia. When nutrients that are usually helpful begin to interfere with brain signaling or blood flow, the effects can be serious and lasting. Given all of these changes in the aging body, it becomes clear that caution is necessary when using supplements or taking in large amounts of nutrients. The best approach is to focus on eating a healthy, balanced diet that includes a variety of foods. This way, the body gets what it needs without being overwhelmed. If a doctor identifies a specific deficiency, such as low vitamin in D or iron, then it's fine to take a supplement under medical guidance. But taking extra vitamins and minerals just in case, or for energy, is not a good idea for older adults. It can lead to problems that are much harder to fix later on. Listening to the body, getting regular checkups, and talking with a healthcare provider about any supplements is the safest way to stay healthy. As we age, our bodies become more sensitive to everything we put into them, including good things like vitamins. Being mindful and thoughtful about what we take can help us avoid unnecessary harm and protect our health for years to come. Every person's body is different. What works for one person might not work for someone else, especially when it comes to health. This is very true when we talk about taking supplements. Supplements are pills, powders, or liquids that contain vitamins, minerals, or other nutrients. They are often used to fill in the gaps in a person's diet. Many people believe that taking supplements can help them feel better, have more energy, or avoid sickness. But in reality, supplements should not be taken just because they are popular or because someone else is taking them. The best way to know if you need a supplement is through proper blood tests and advice from a doctor, not by guessing or following the latest trend. The human body needs certain nutrients to stay healthy. These include vitamins like A, C, D, E, and B12, and minerals like iron, calcium, zinc, and magnesium. Normally, we get these nutrients from the food we eat. Fruits, vegetables, whole grains, dairy products, meat, fish, and legumes provide most of the nutrients our bodies need. But sometimes, due to age, illness, or other health issues, a person's body might not absorb or use nutrients properly. This is when a supplement may be needed. However, it is very important to find out exactly what your body is lacking before adding any extra vitamins or minerals. This can only be done through medical testing. A blood test can show if someone has too little or too much of a nutrient. For example, a blood test can tell if your vitamin D is low, if your iron levels are too high, or if you need more B12. Without these tests, it is almost impossible to know what is truly happening inside your body. Sometimes, a person may feel tired or weak and think they need more iron, when in fact they already have enough or even too much. Taking more in this case could actually cause harm. Too much iron can build up in the body and damage the liver or heart. The same is true for other nutrients as well. This is why guessing is not a good idea. Many people take supplements because they read about them online or hear about them from friends or family. They might also see advertisements on TV or social media saying that a certain supplement will give them energy, help them sleep, or protect them from disease. While some of these claims may sound appealing, they are not always based on real science, and even if the supplement is helpful for some people, it might not be right for you. Every body is unique. Age, weight, medical history, and other factors all play a role in what your body needs. Older adults especially need to be careful. As we age, our organs change. Our kidneys, liver, and digestive system may not work as well as they used to. These organs are responsible for processing and removing extra nutrients from the body. If they are not working properly, extra vitamins and minerals can build up in the body and cause problems. For example, high doses of vitamin A can harm the liver. Too much calcium can cause kidney stones. These are not small problems, and they can be hard to fix once they begin. This is why it is so important to only take what your body truly needs, based on test results and medical advice. It's also important to know that more is not always better. Some people think that if a little bit of a vitamin is good, then a lot must be better, but this is not true. The body only needs a certain amount of each nutrient. Once that amount is reached, taking more does not help. In fact, it can do harm. Water-soluble vitamins like vitamin C and B vitamins usually leave the body in urine if we take too much, but fat-soluble vitamins like A, D, E, and K are stored in the body, and too much of them can be dangerous over time. Taking high doses of these without a reason can lead to serious health issues. Another reason not to follow general trends is that health information on the internet is not always reliable. Some websites or influencers may promote products just to make money. They might not have the training or knowledge to understand the science behind supplements. They may offer advice that sounds good but is not backed by real medical studies. Trusting these sources instead of a qualified doctor can lead to poor decisions and unwanted health effects. Always be cautious about where you get your health information. Some people also take multiple supplements at once, without realizing that the ingredients can overlap. For example, a person might take a multivitamin, a bone health supplement, and a sleep aid, all of which contain magnesium or vitamin D. In the end, they may be getting 2 or 3 times the safe amount without knowing it. This can stress the body and cause damage slowly over time. Again, this is why proper testing and medical advice are so important. A doctor or nutrition expert can help you understand what you are already getting from your diet and what, if anything, you might need to add. Medications are another concern. Many older adults take medications for things like blood pressure, diabetes, or cholesterol. Some supplements can interact with these medications, changing how they work or causing unwanted side effects. For example, vitamin K can interfere with blood thinners, and calcium can reduce how well certain medications are absorbed. Only a doctor or pharmacist can safely check for these interactions. This is another reason why self-prescribing supplements can be risky. It's also worth mentioning that the supplement industry is not as tightly controlled as the drug industry. This means that some products may not contain what they claim. Others might contain fillers, added sugars, or even harmful substances. Without strong regulation, it's hard to be sure what you're getting. This is why professional guidance is so important. A healthcare provider can recommend trusted brands and make sure the supplements are necessary, safe, and effective. In the end, good health is not about chasing the latest trend or taking every supplement that seems helpful. It's about knowing your body and making informed choices. Blood tests are a clear, scientific way to measure what your body needs. Medical advice adds the experience and understanding of how the body works and what might be best for your age, lifestyle, and health conditions. These tools are much more reliable than guessing or following the crowd. So before adding any supplements to your daily routine, stop and think. Do I really need this? What does my body say? Have I had a test? Have I talked to a doctor? These are the right questions to ask. Supplements can be useful and even necessary in some cases, but they should never be taken lightly. With the right knowledge and medical support, you can use supplements wisely and safely, helping your body without risking your health. Living a long and healthy life is something many people hope for. The idea of living longer with energy, clear thinking, and the ability to enjoy each day is not just about luck or good genes. It depends a lot on the choices we make every day and how well we understand our own bodies. Over time, scientists have learned that there is no one-size-fits-all answer to staying healthy and living longer. Every person is different. Our bodies, our health needs, and even how we respond to food, exercise, sleep, and stress can vary greatly from person to person. That's why the best way to think about health and longevity is to use a personal and scientific approach that fits your unique body and life. This kind of approach starts with paying attention to your own body. This means noticing how you feel after eating certain foods, how you sleep, how you handle stress, and what kind of physical activity feels right for you. Some people feel great after a long run, while others feel better after a slow walk or a yoga session. Some people need a lot of sleep to feel rested, while others do just fine with less. The key is learning to listen to the signals your body is sending. This kind of self-awareness is powerful. It helps you make better decisions about what works best for your health. Along with being aware of how you feel, it's also important to use tools from science. Modern science offers many ways to better understand your body. Simple blood tests, for example, can show if you are getting the right amount of nutrients, how your organs are working, or if you are at risk for certain diseases. These tests give real information, not guesses, that you can use to guide your choices. For example, if a blood test shows that you are low in vitamin D, you can take steps to improve it, such as spending more time in the sun or using a supplement. If your cholesterol is high, you might change your diet or add more exercise. This is a much smarter way to take care of your health than just doing what everyone else is doing or following trends that may not be right for you. Personalized health also means thinking about your medical history and family background. If heart disease runs in your family, you may need to be more careful about your diet and get regular heart checkups. If diabetes is common in your family, you might need to watch your blood sugar more closely. Knowing this kind of information helps you plan ahead and make choices that protect your health in the long run. As we grow older, our bodies change. What worked when we were 25 might not work the same way when we are 60. Metabolism slows down, muscle mass decreases, and organs like the liver and kidneys may not work as efficiently. This is why it's so important to keep checking in with your body. A food or supplement that helped you years ago might now cause problems. A type of exercise that once gave you energy might now leave you tired or sore. Paying close attention and adjusting your choices over time is part of a smart, science-based approach to health. Another part of this strategy is managing stress. Many studies show that stress can have a big effect on how long and how well we live. Chronic stress can hurt the brain, the heart, and the immune system, but each person responds to stress in their own way. Some people need quiet time alone to recharge. Others feel better after talking to a friend or spending time in nature. What matters most is finding what helps you feel calm, clear, and focused. When you know what helps you manage stress, you can use it as a tool to protect your health and support your longevity. Sleep is also a key part of living well and living long. When we sleep, the body repairs itself. The brain clears out waste, muscles recover, and hormones reset. Not getting enough quality sleep can affect memory, mood, and the immune system. But again, sleep needs vary from person to person. Some people need a full 8 hours. Others might feel good with 6 or 7. Some people sleep better in a completely dark room, while others need background noise. Learning what works for you and creating a routine that supports good sleep is another important part of a personalized health plan. Food is another area where a personal approach is very helpful. Some people do well with a diet that is high in healthy fats, while others feel better with more protein or fiber. Some people are sensitive to certain foods like dairy or gluten, while others are not. The goal is to find a way of eating that gives you steady energy, supports your digestion, and helps you feel your best. This might take some trial and error, but it is worth the effort. Eating in a way that fits your own body, not just following a popular diet, can make a big difference in your long-term health. Exercise is also important, but again, what works for one person may not work for another. Some people love lifting weights. Others prefer walking, dancing, or swimming. The key is to stay active in a way that feels good to you. Regular movement helps keep the heart strong, the muscles firm, and the brain sharp. It also helps with mood and sleep. But pushing your body too hard or doing exercises that cause pain or injury can lead to problems. The right kind of movement is the one that you enjoy and can do consistently over time. Finally, a personal, science-based approach to longevity also means building good habits and routines. These include drinking enough water, spending time with people you care about, and taking breaks when you need them. It also means having regular checkups with your doctor and being honest about how you feel. The more information you have, the better decisions you can make. In the end, living a long and healthy life is not about doing what everyone else is doing. It is about knowing yourself, using science to understand your body, and making choices that support your unique needs. This may take some time, and it may involve asking for help from healthcare professionals. But the result is worth it. You will feel better, have more energy, and enjoy a higher quality of life when you take a thoughtful, personalized approach to your health, one based on science and self-awareness. You give yourself the best chance to live not just a longer life, but a better one. You learn to respect your body, care for it wisely, and give it what it needs, not too much, not too little, but just the right amount. This kind of balance is the true key to lasting health and happiness. In closing, the journey to a longer, healthier life is not about quick fixes or following the latest health fads. It's about becoming deeply in tune with your own body and mind, understanding what helps you thrive and what may silently hold you back. When you combine personal awareness with science-backed information, you move from guesswork to real insight. You begin to make choices that are not only smarter, but also more sustainable. This is the path of precision, of wisdom, and of true self-care. Longevity is not just about adding years to your life, it's about adding life to your years. And the most powerful way to do that is by crafting a health strategy that is as unique as you are, personalized. Measured, informed, intentional, with each thoughtful choice, you are investing in a future that is not only longer, but richer in quality, clarity, and purpose. So as you move forward, let your guide be curiosity, not fear, evidence, not hype, and self-respect, not comparison. Your health is your most valuable asset. Treat it with the precision, care, and attention it truly deserves.